Welcome back to HDHP HSA Health Disclosure, Healthy Pricing, Healthy Premium with Health Solutions Advantage, folks. This is also known as HIP, Health Insurance Personalized. We've been talking about personalized healthcare for quite some time. And how do we implement, especially for people on Medicare? That is, a Medicare funds are dwindling, and there's got to be a solution, folks. Paul Ryan, who has been well versed in this Medicare, he was trying to raise the retirement age to 67. He also has had several plans to make Medicare solvent. So let's look into that, how we can set up a Medicare personal care account. This is something which makes sense, especially when Medicare is going to be insolvent because the funds are being exhausted by the usage, and the cost of the care has been rising. So there's got to be some simple solution, folks. So building a Medicare personal care account, Medicare personal care account. When you talk about consumer-centric Medicare, or so-called personalized healthcare or customer-driven healthcare, this makes sense, folks. Every beneficiary who chooses for this type of option to set up a personal care account will be established in their personal name. The account will be on their personal name. Account would start with a zero balance and would be funded through a number of sources, folks, including employers offering post-retirement healthcare supplements, tax-deductible individual contributions, and Medicare deposit based upon voluntary patient participation in cost-effective treatments and through compliance incentive programs. So these are the several sources we can fund personal care accounts. Personal care accounts would be individual accounts under the control of the individual. There would be many ways to increase the level of personal care account funding or funds. How do we increase the funds into the personal care account, you may ask? Number one, as I talked about earlier, employers who provide post-retirement health care could contribute directly to the so-called PCA, personal care accounts. Employers' contribution would be tax deductible as a business expense and receive tax-free by the retiree. And additional employer funding could come from HRAs, health reimbursement accounts, and HSAs, so-called health savings accounts, funds that would be rolled over at retirement from an existing consumer-centric employer plan. Consumer-centric employer plan. And number two, Medicare could establish an incentive program, could set up an incentive program to reward compliance with best practice, medical care, and treatments. So it is purely voluntary, folks. Voluntary disease management programs would reward beneficiaries for compliance in following best practices, best practices of care. So increased compliance with personal care accounts and incentives would generate significant savings from fewer hospitalizations for the diagnosis being treated. For the diagnosis being treated. The Leapfrog Group, a consortium of employers, states that patients who would go to the hospitals that frequently perform these high-risk treatments or procedures, or to hospitals that have demonstrated a good record for patient outcomes, have the best chance of surviving and successfully recovering. For example, several private companies have deployed comparative statistics by hospital to show cost and quality, like mortality and morbidity, that identify best practices at a lower cost. Using this type of data, personal care account incentive award programs would drive competition among hospitals based on leading edge improvements in healthcare. Number 4, Medicare beneficiaries that use hospitals with recognized quality standards would receive a personal care account incentive bonus, so-called PCA incentive bonus. So a promising approach for consumer-centric plans reimburse physicians who provide a recognizable value. That high-volume surgeons tend to have better outcomes. So PCA incentives could be awarded to encourage using physicians with better outcomes. That is number 5. So PCA incentives, like personal care account incentives, would encourage using physicians with better outcomes because they're high volume surgeons and they will have better results. And what is number 6? Medicare beneficiaries could be allowed to contribute to their personal care accounts with tax-deductible contributions. The amount of individual contribution could be limited to a multiple of the Medicare Part A deductible. Let me repeat again. Number 6, Medicare beneficiaries could be allowed to contribute to the PCAs and tax-deductible contribution. The amount of individual contribution could be limited to a multiple of the Medicare Part A deductible. And number 7, Medicare beneficiaries could be allowed to transfer tax-free certain amounts of life insurance cash value directly into the personal care accounts. certain values from the life insurance could be transferred without tax implications. And number 8, PCAs, personal care accounts, would accumulate tax-free. As with the current health savings accounts, investments would be through government-approved financial investment vehicles. So this is the way to go, folks. This is to meet the demand for prescription drugs and the expansion of Medicare. We as a nation must replace supply control and price control model of Medicare to a demand control and patient control model. We need to switch that from supply to the demand and patient control. It has to be patient-centric. One key to workable demand control is increase the personal responsibility of the individual and more individual control over the healthcare expenditures. So consumer-centric Medicare and personal care accounts are the basis for that transformation. Finally, it boils down to the congressional support. If we have a financially viable Medicare program, consumer-centric Medicare offers a new direction of thinking about how to finance prescription drugs and other benefit needs of the elderly. This will solve the problem because of the dwindling funds in Medicare Part D program and cost to the consumers. So this will solve that problem. The problems of Medicare are huge and intimidating because the funds are dwindling, as I said. Baby boomers generation beyond will demand a new model of Medicare. Believe me, it's coming. It has to. That's the only way Medicare can be solvent. That reflects their needs. The time is right for Medicare reform, that ideas can move outdated plan design to a 21st century consumer-centric Medicare. Consumer-centric Medicare or demand control Medicare, where the cost consumers and customers will demand affordability and they demand competition, not consolidation, and they demand full transparency, folks. They demand full price transparency in healthcare costs. That's the only way we can solve this Medicare. And it makes sense to have a Medicare Personal Care Account. That is a new trend, folks. Let's look into it. If you want to have Medicare, if you really want to do this, Medicare for all, this is one way we can implement by setting up personal care accounts. If Medicare for all should be consumer-driven and patient-centric. That's probably the best alternative, because right now it is Medicare also is going through a lot of financial problems, and they're giving away the expenditure for Medicare has not cut down unless consumers take control. Expenditure Medicare will keep going up, not go back, unless consumers take charge. Consumers are the ultimate force will bring down the cost, folks. That's what I believe. Anytime there's a consumer-driven healthcare, retail, groceries, it doesn't matter. Whenever the consumers are in the front line, they demand better care, better quality care, and affordable premiums, affordable healthcare costs, along with full price transparency. That's the consumer's demand. This is the best way to solve our healthcare crisis. Thank you for listening. If you do like the channel, subscribe, share, and hit that bell. Hit the notification. And I'll continue to, as a consumer's doctor, on the behalf of Foremost Organization, I'll continue to give some ideas how we can solve the healthcare and better healthcare quality and services to all Americans. Thank you for listening, and we will see you in the next episode of HDHP HSA, Health Disclosure Healthy Premium with Health Solutions Advantage. This is Consumer's Doctor on behalf of Foremost Organization. Salute. Bye.